I'll get started in 2 minutes. I see we have a lot of participants joining. Okay, we'll get started. Hello, everyone. I'm Dr. Kenya Beard, and I am the Associate Provost for Social Mission and Academic Excellence at Chamberlain University. I also serve as chair of the Academy's Diversity and Inclusivity Committee. On behalf of the illustrious members of the D&I Committee, I am thrilled to share that we have over 600 participants joining us today. Have you ever witnessed, echoed, or became the recipient of a discriminatory remark? How did you respond? To be sure, speaking up and against injustices in a meaningful way is a requisite skill that all nurses should possess. But whose work can embolden us with the voice to co-create an inclusive environment that nurtures an ethos of belonging? To answer that question, I'm pleased to introduce our speaker and facilitator for today's workshop, Dr. Kupiri Ackerman-Barger, who is the Associate Dean for Health Equity, Diversity, and Inclusion, and Clinical Professor and Director of Faculty Development for Education and Teaching at the Betty Irene Moore School of Nursing at the University of California, Davis. She is also a member of the Academy's Diversity and Inclusivity Committee. Dr. Ackerman-Barger is a leading expert in advancing inclusive learning environments, education equity, and workforce diversity. She is a national consultant and speaker on strategies to help underserved and underrepresented groups in health professions thrive academically. Her Microaggressions Triangle model is a framework that is used to educate individuals on how to understand and respond to microaggressions from a humanistic approach. I want to recognize the members of the Diversity and Inclusivity Committees whose work supports the Academy's mission of healthy lives for all people and upholds the organization's values of equity, diversity, and inclusivity, inquiry, integrity, and courage. In particular, I want to thank Kupiri Ackerman-Barger, Deborah Barksdale, Susan Cools, Emerson E., and Usha Menon for serving on the planning work group for this event. And now some housekeeping. The American Academy of Nursing is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Center's Commission on Accreditation. 1.5 contact hours are awarded by the American Academy of Nursing following the completion of the virtual event and the post-conference evaluation. Many schools of nursing and nursing organizations have been prioritizing diversity, equity, and inclusion and asking how we can become more skilled at mitigating and responding to racism, discrimination, and microaggressions. The Microaggression Triangle model is a framework that provides a way of thinking and decision-making that can help individuals and institutions make informed decisions about how to respond to an interaction or event that undermines inclusion. In this session, participants will learn how this model uses a humanistic approach, which acknowledges that humans and human interactions are complex and contextual, and that to make truly informed decisions, we must seek to understand the dynamics and people involved. Following the conclusion of this event, learners will be able to, 1, identify the role of each member involved in the microaggression, recipient, source of the microaggression, and bystander. 2, discuss the nature of the microaggression and how it could have a hurtful impact on the recipient, bystanders, and/or community. 3, analyze the historical, structural, and cultural context of the microaggression. 4, differentiate how the individuals involved may view the situation differently. And 5, discuss responses from each member involved in the interaction that could uphold principles of inclusion and community. And now, questions. If you have any questions, please put your thoughts or ideas or concerns, comments, and questions in the Q&A box located on the bottom of your screen. And now, without further ado, please join me in a warm welcome, Dr. Ackerman-Barger.
Thank you, Dr. Beard. I really appreciate the introduction, and I want to say thank you to all of the folks who took the time and have the interest in this important topic. And I'm going to bring up my screen. Just give me a moment. All right, as we get started, I would like to acknowledge that, some of the data that I'm going to be sharing with you today is available because of the generous funding from HRSA and for the University of California Davis Center for a Diverse Healthcare Workforce. And I also want to share that the views that are shown today are not necessarily representative of those funders and those supporters. If you would like to cite anything from today, here is a citation on the beginning slide. And you'll also notice that as I'm talking about data, I will also be offering citations on the footer of each of the screens. So let's go ahead and get started. So what we'll do is we'll talk about microaggressions for a little while to make sure that we're using common language about what microaggressions mean and how they're experienced and what the impact are. So this gentleman on the screen here, this is Dr. Chester Pierce. He was a psychiatrist. We lost him in 2016, but his legacy remains. So the first time we saw the term microaggression in the literature was in a chapter here cited below. It was in 1970. And when he used the term microaggression, he was indeed talking about the experiences of African-American people. But as this notion, this concept has evolved over time, we're realizing that microaggressions can be experienced across identities. So what's the definition? Here's a definition. Microaggressions are subtle statements and behaviors that communicate denigrating messages to people based on some aspect of their identity. Some citations there are Kevin Nadal and Daryl Wing-Sue. If you want to know everything that there is to know about microaggressions, I do have the cover of a book called Microaggressions in Everyday Life. It goes into like the subcategories, the different kinds of microaggressions that exist. It's a resource that I highly recommend. So let's review some examples of microaggressions reported by nursing students. So these are things that in the multiple studies that I've done over time that students have reported to me. So said to a Native American nursing student, why don't you tell your classmates about the health issues of Native Americans? And so in the conversation with this particular student, she pointed out that, she's the student and not the teacher. She doesn't know everything that there is to know about Native Americans. She, represents herself and the people that are in her close circle, but Native American people are very diverse across the country and have different health issues. And then she also pointed out that when teachers prepare for a class, they prepare for a class. They're not asked in a moment to represent and teach an entire class. So she viewed that as a microaggression. Said to a Latino nursing student who was doing really well on the nursing floor that he was working on, and someone told him that he's a credit to his race, which seems like a compliment, except for that really icky feeling of it not being a compliment. Said to a Black nursing student, you were only admitted to fulfill a diversity goal. This is a really common thing that students of color hear, that their merit has nothing to do with their admission, that they were just there to fill a quota. Done to a Black nursing student, silent stares when she suggests a nursing intervention during a group activity. Said to a male nurse, I didn't know that men could be so caring. Said to a student with they, them pronouns on their badge, young people these days can't even decide if they are a boy or a girl. And you gotta applaud that person with the last statement that they managed to get 2 microaggressions into 1 sentence. It's an ageist comment, and it's also a transphobic comment. So we are opening the poll, and with the definition and some examples, we're interested in finding out, have you been the recipient of a microaggression? Is there a time when you experienced that? Go ahead and put your answer in, and we'll give it a few minutes and then we'll share what the results are. I'm interested to see what your experiences are. Go ahead and put your answer in. Can you think of a time when you were the recipient of a microaggression? Yes, no, or not sure. How is the poll looking? Are we getting some answers, Rachel or Ellie? All right, in the interest of time, if we could go ahead and show what those results look like. All right, look at that. So thank you for participating in this poll. So a lot of people have experienced a microaggression at some point. There are a few people, 6%, very few people that are pretty sure that they haven't, a no. And then there are some folks that are like, not sure if I've experienced it or not. Okay, that's interesting and not at all surprising. So we can go ahead and close down the poll. So let's talk about the impact of microaggressions. We know that a lot of people in this session have experienced a microaggression. The interesting thing about microaggressions is that, you can argue that anybody can probably survive and heal from a single microaggression, but usually that's not how they work. Usually when you have an identity that is stigmatized in some way, you have an accumulation of examples of microaggressions that have occurred around that identity. And that's what's tricky about microaggressions, is that they're subtle. So some people that are bystanders or that you talk with about it may not even, they're like, why are you upset by that? That's no big deal. But for you, you're having this huge emotional impact where you're trying to figure out what was meant by that, how do you respond to it? And so that accumulation over time has health impacts. The first one that I want to talk about is mental health effects, particularly in the area of anxiety and depression. And this has been noted, over and over in the literature, that there is an association between instances of microaggressions and depression and anxiety. And we also know that depression and anxiety can lead to suicide ideation and also suicide attempts, right? So those are major healthcare issues that, if we could be more aware of the times that were the sources of microaggressions, we may be able to mitigate that experience for people in general, but particularly for our students and for our patients. Like, that should not be something that they're experiencing from their faculty or a patient from their care provider. In terms of physical health problems, if you think about the stress response and you think about the term allostatic load. Allostatic load refers to the weathering or the wear and tear on the body in relationship to stress over time. And so the biomarkers for those are high blood pressure and the presence of stress hormones in the body. And I just want to, I mean, I know that you know this, but I want you to just think about this in terms of the learning environments and the healing environments that we want to create for our students and patients. So under the stress response, your body, an individual's body, has evolved over time to have a stress response that helps us deal with something that is a threat. It's hugely resource intensive on our body. And because it's so resource intensive, we need to go through phases of rest and relaxation. It's the sympathetic mode into the parasympathetic mode. So you need time to rest, restore, and repair, right? And so if the stress response is never turned off, like if you don't get a signal to turn off, like there's a signal to turn on the stress response, you also need a signal that it's okay to turn off the stress response. So if that doesn't turn off, you're stuck in this perpetual state of stress. Or if the times in between stressful events are too short for the body to fully repair. So then think about the stress response in the moment. What's happening at the different levels of the body, the different system levels of the body. In the cardiovascular system, you have hypertension, you have tachycardia, you have increased contractility and conductivity, which increase cardiac output so that your body, your vital organs, your muscles are getting the nutrients and the oxygen that they need in this highly resource intensive moment. At the level of the pancreas and the liver, the body is making more sugar available in the blood so that you have the energy to deal with the stressful situation. There are some systems then that take a back seat during the stress response. These are the immune system, the GI and metabolic system, and the reproductive system. So again, in a short amount of time where you're dealing with a stressor, that should be okay. If you are stuck there or you are there too often, we can see long-term effects at each of those system levels. At the cardiovascular system, hypertension is problematic. We know that hypertension can lead to cardiomegaly and dysrhythmias, particularly atrial fibrillation, which can cause clots, strokes. We know that with hypertension, there's thinning of the cardiovascular vessels, such that with that thinning, you become more prone to cardiovascular disease, right? So there is an explanation why there are groups of people that experience higher rates of cardiovascular disease. It's not necessarily a genetic predisposition on the part of African American, Latinx, Hispanic, Native American, and so forth. At the level of the pancreas and the liver, when there is sugar in the blood all the time, we call that diabetes. At the level of the immune system that is taking a back seat, that can look like autoimmune disorders or chronic illness. At the level of the GI system and at the level of the metabolic system, when those systems are taking a back seat, that can look like, of course, ulcers, constipation, some GI issues. From a metabolic standpoint, if you're not prioritizing the metabolic system as it should, that can look like obesity over time, right? And then the reproductive system, why is it that and the answer to this is going to be complicated, but here's one aspect to it. Why are there such poor maternal health outcomes for Black women in the United States and low infant birth weights? Could it be a response to stress in addition to some of the clinical decisions that are made about prioritization, et cetera? But could it be that it is the stress response? So again, I want to emphasize that a one-off microaggression is probably not going to do it. But the cumulative experiences of microaggressions over time, discrimination, prejudice, lack of opportunity to access the services and resources of our society, those over time can create mental health and physical health problems. Then there's the lack of trust in the healthcare system. If you come into the healthcare system and you are experiencing microaggressions, condescension, blaming for your healthcare issue, it's likely that you're not going to trust that people have your best interests in mind. And you, as any smart, rational person, would probably start to avoid that situation that is causing you pain. Let's take, for example, if you're a person living with obesity and you go into the healthcare system, there is a script that you're going to hear over and over and over. And it goes something like this: you need to lose weight. If you want to be healthy, you need to lose weight. And that means that you need to diet and exercise. And the narrow focus, the oversimplification of obesity on the part of the provider can feel like a microaggression. Like you are not giving me any tools and you're blaming me for my healthcare issue, as if I don't understand how to take care of myself or my body, when oftentimes it is lack of resources, lack of the time or ability to go to the gym or to eat, specific foods. It's far more complicated than that. But if you're hearing that over and over, you may not trust your healthcare provider or your healthcare system and avoid it. And when people are doing that, what happens is they skip prevention, and then they wait until later in their illness, until whatever it is that is ailing them is undeniable and you can't ignore it anymore. And oftentimes that's so late into the progression of an illness that there's not as much that we can do about it. So there are also social and cognitive impacts of microaggressions. One, they perpetuate stereotypes and passively allow society to devalue groups. So every time a microaggression or a comment or a joke goes unchallenged by the community overall, it makes it seem like it's okay to behave and speak and do those sorts of things. So there is something really powerful when the community says, whoa, not funny, not okay. Hey, this is making me feel uncomfortable. It also causes energy to be diverted away from learning and or productivity. So if you think about the process of learning, most of the learning process is happening in the prefrontal cortex. So if a student is thrust into the limbic system because they sense a threat in the form of a microaggression or devaluing or not belonging, there's going to be a disproportionate amount of energy that's spent in the back of the brain experiencing the emotion. This is not a decision that people make. This is something that is really difficult to mitigate when you're in the moment of this. So that's energy that's not up here learning and processing information, contextualizing information so that you can make really great clinical decisions or clinical thinking, critical thinking. And same in the hospital setting, right? If folks are trying to deal with the microaggressions that they're experiencing at work, they may be not performing at their optimum. And I don't know about you, but when I was an ICU nurse, I really wanted every single member of the team to be as much in their prefrontal cortex as possible when we were caring for patients so that we could have this teamwork that would improve health outcomes. So it's really important then for us to create those academic climates and those work climates where people feel included, where they feel valued, and we're minimizing the amount of times that people are experiencing microaggressions and discrimination, racism, sexism, homophobia, all of those things. So what I'm going to do is I'm going to show you some data. This is a study that my colleagues and I did in 2020. It was a sample of 862 nursing students who represented 129 schools of nursing from across the country. We used several different tools. One was the modified racial ethnic microaggression scale called the REM scale. This was developed by Kevin Nadal in 2007. We also developed a 6-item satisfaction with nursing schools survey, and we used the patient health questionnaire 2 called the PHQ-2, which is a screener, just a brief screener for depression. statistical analyses that we use: t-test, ANOVA, Pearson's product correlation, and a Bonferroni. And I am going to share a little bit of that data with you here. So we had 3 hypotheses. One, that underrepresented nursing students would report a higher frequency of microaggressions than white students. And our findings agreed with this. Yes, this was true, with Black students reporting the highest rate of microaggressions. We expected that a higher frequency of microaggressions would be significantly associated with lesser satisfaction with nursing training. Yes, and this was more so with underrepresented students than with white students. And when I say underrepresented, the categories that we used were African American, Black, Latinx, Hispanic, Native American, and Southeast Asian. Number 3, the hypothesis was that the frequency of microaggressions would be significantly associated with higher scores on depression screening. So this was actually true across groups. We didn't see that any specific demographic group was more depressed than another group, but we did see overall that there seemed to be a relationship between experiences of microaggressions and symptoms of depression and anxiety, which correlates with the literature that I showed you earlier. So on the other part of the screen, you will see some of the questions that we asked. So you'll see the associated hypothesis. So all of the ones that have the number 1, those were frequent. These are ones that students experienced multiple times. People mistake me for someone else who shares an aspect of my identity. People are surprised by how well I speak English. My ideas are ignored, but other people are applauded when they say the same exact thing. And then we have some that were correlated with depression and anxiety. People devalue my opinion on patient care. That was associated with both lesser satisfaction and depression. People seemed surprised by my intelligence. That was a frequent one and had an association with experiences of depression. I am made to feel unwelcome in a group, lesser satisfaction. People are cautious with their personal belongings around me. That one was frequent, and that one was associated with depression. I am reluctant to ask questions because I fear I will be judged. That one was frequent, related to lesser satisfaction and depression. I feel socially isolated at my nursing school or program. Again, frequent, lesser satisfaction, and related to depression or associated with depression. Faculty discourage me from pursuing a nursing field I am interested in. Maybe not as frequent, but related to lesser satisfaction and depression. And then 2 that were related to or associated with depression. People assume I could be violent, and I feel invisible in my nursing program or school. So some colleagues and I are working on validating that tool that I just showed you. So one of the things that we're looking at are which of those questions really seemed to be indicative of experiences of racism. And these were the 7 that had the highest association. And I just want to sit with these for a moment and think about for a moment how we could change these in our nursing classrooms or in our work environments. I am made to feel unwelcome in a group. I am reluctant to ask questions because I fear I will be judged. People devalue my opinion on patient care. My ideas are ignored, but when other people say the same thing, they are applauded. People assume that I will be violent. My ideas in the classroom are met with hostility, and people trivialize my ideas in the classroom. So now I'm going to move into some qualitative data. This was published in 2020. You can see the citation below. One of the areas of microaggressions was students feeling devalued. And this is an example of a student statement. A student said, people would not respond to the things that I'd say in the classroom, but they would respond to what a white person said, even if it was exactly the same thing. They would not acknowledge that I had contributed anything to the discussion. And remember that correlates with the quantitative data from above. Assumption of intellectual inferiority. A student said, sometimes in a study group of 4 or 5 of us, I wouldn't be asked, what did you get for this question? What did you think about this? I'm not the go-to person. Sometimes this upsets me because I do know the answer and I can explain it well. I don't understand why other students don't see me as having equal knowledge on this particular topic, which is very frustrating because it makes me not want to participate in the group if I feel like no one thinks that I'm bringing anything of value. Another area that students talked about was teaching biological inferiority. So a student said, yeah, that's one of the most challenging things is to be in an institution that uses the word innovative in its language or leader in its language as far as the mission, vision, and values, but they refuse to address historical and social context to health disparities. And being told by a professor that race is a biological fact in 2019 was deeply concerning to not only the quality of my education, but just like, I didn't know that eugenics is on the upswing, and I feel like, and she named her school, is contributing to that. So let's look at the impact of microaggressions. So we used in vivo for our qualitative data, and we ran a word frequency query. And one of the things you can do is create a word cloud. So the words that are bigger had more mentions, but I wanted you to see sort of the cloud of experience that are related to being on the receiving end of a microaggression. So of course there's anger, it feels bad, students felt doubt and frustration, but there are all these other things. People said paranoia, excluded, hypersensitive, they felt vulnerable, disgusted. They felt that things were unattainable or worried. All of these things are creating really a barrier to an ideal learning environment. So this is what a student said about the impact of microaggressions. I've had to go on anxiety meds for depression because of the stress that we go through. I've never had to do that before, getting into and then named her school. So I feel, I don't know if it's the consequence of the school in itself or if it's the microaggressions. Divesting in discourse was another theme. A student said, yes, it has had an impact on me academically. In the past, if I had had questions, I would have just raised my hand. I wouldn't have thought twice about it, and I would have sought out the answer. Now I think twice. In fact, every day before I go to school, I look at this thing that I wrote for myself that says, please the teacher, melt into the metal, stay silent. I try to look at that and read that every day before I leave the house to remind myself to keep my head down and keep my mouth shut and not to draw any attention to myself. And I just want to pause here for a moment and just a reminder about the value of diversity. Yes, we need to have diversity because it's a social justice issue. There should be equal access to everyone who wants to be a nurse to become a nurse. There should be the opportunity for patients to be able to work with a care provider that has a background similar to them. Those things are given. In addition to that, the value of diversity is bringing in those perspectives so that people can contribute their way of thinking, processing information, their experience of the world, their backgrounds, their cultures. If we have students that feel like they need to keep their head down and keep their mouth shut, we lose some of the richness of diversity. I mean, and diversity is not just having students sit down in a class together and co-learn. It's really about that human interaction and those discussions that take place. But if the classroom environments are not inclusive, we are not going to have the benefit of that diversity bonus. So faces of resilience. A lot of times we talk about, we need to help our students become more resilient. So let's talk about that for a minute. A student said, it made me work so hard to prove her wrong that I ended up doing so well on my final. Like a grade that's almost impossible to get, I pushed myself. The only thing is I'm a little afraid. The truth is drive is good, but the type of drive that got me there, it's not a good type of drive. So these are often the students that are staying up all night long, working, and that doesn't come without cost. There is something called the John Henry syndrome. And if you don't know the legend of John Henry, he was a Black man who was racing a steam engine to burrow a tunnel into a rock mountain. So legend has it that John Henry beat the steam train, right? He's chipping away, working, beats the steam train, and then drops over dead. And so, that of course is a hyperbolic example of, but that kind of stress and that kind of drive, that takes its toll over time on the body. That can look like a stress response. We don't want to cause harm to our students, making them feel like they have to prove themselves over and over and over, above and beyond what their classmates are expected. So again, we get back to mental health issues and we come back to physical health issues. And I don't know about you, but when I'm in the classroom with students, I don't want them to be harmed. I want them to thrive. Same with my patients. So we are going to get into talking about the Microaggressions Triangle model. Here is the citation for it and an abstract for it. I'm going to go through it point by point with you. So the goals of the Microaggressions Triangle model, one is it's intended to be a humanistic approach. And what I mean by that is that we understand that humans are complicated and complex. We oftentimes like to label other people. It's really convenient somehow that we can label person as a good person or a bad person. We can label them as racist or non-racist, homophobic or not homophobic, a mean person or a nice person. All of those are binaries. And I'm sure when you think of yourself, you know that you're far more complicated than being mean or nice. For example, in the morning, you might be driving to work, you have your coffee, you're in a good mood, you're looking forward to work, and you are on your best behavior. Somebody cuts in front of you in traffic, and you're like, whatever, they're probably just in a hurry like me. But on the way home, you're tired. You've worked all day. You've been in moral distress. You maybe didn't get your lunch. You really want to get home. Somebody cuts in front of you, and now you're shouting all sorts of things that you wouldn't want your kids to hear, right? So does that make you a mean person? But you were nice in the morning. Are you a mean person or a nice person? It's more complicated than that. We can have those moments in time. So it's really appreciating that other individuals are just as complicated as we are, that somebody can actually have values around diversity and inclusion and violate those values, whether they're aware of it or not. And we'll get into that some more. The other thing is that we're looking for opportunities to promote inclusion excellence. We want to look at an interaction and see, is there a teachable moment? Is there something that we can do in this moment to uphold principles of community and inclusion excellence? And so part of that decision tree is that sometimes you'll say, yes, this is the perfect moment. It also might be that you decide that this is not the moment. It is not safe right now. This is going above and beyond a microaggression into an act of overt racism or discrimination. And maybe I'm not going to fuss around and try to figure out what their motivation was. I need to get myself or students or whoever safe, whether that's physical safety or whether that's safety in terms of status. Students, they risk a lot if they're, if they are seen as being hypersensitive, or if they overreact or react severely when they're the source of a microaggression, or if they complain about a faculty member who has microaggressed them, we can't guarantee their safety, right? We can say that our institution has a no retaliation policy, but enforcing that is really, really difficult. How do we know that when a professor grades a paper on a student that they are doing it objectively, consciously or not? to somebody that has said, hey, you're not providing an inclusive classroom environment, or you said something racist to me? How do we know when it's time to write letters of recommendation, or even in terms of poisoning the well as students are progressing through? So there is that notion of physical safety, but there's also the safety of status. Part of the goal of the microaggressions triangle model is to prevent microaggressions. And so we know that we can't control the behaviors of other people. We can only control our own behavior. So we want to mitigate the times that we are the source of microaggressions. And then those times that we are and we become aware of it, we want to address that appropriately so that we can help uphold a community of inclusion. Using the restorative justice model, we want to think about how we can repair and reestablish relationships. That's part of a community. And again, maybe that isn't going to be possible. That is a decision that is on the table and can be made. But when we're using the microaggressions triangle model, we want to at least give that a chance. Is there a possibility in this moment? Also, the notion of restoring reputations. Our reputations are us. They're, you know, the external version of us. We have our inner identity and our external identity, and we work on those reputations throughout a lifetime. And so we know by looking at social media, the news, all of these things, that it is possible for your reputation to be deeply impaired or destroyed in a moment. Something that you've worked on all of your life can be destroyed in a moment. And so we call that cancel culture. And I'm going to say that if we have sort of a tool belt, or a toolkit of different strategies for addressing microaggressions, discrimination, racism, that canceling someone is one of the options there. That is something that can be used, but it's a big option. That's like pulling out the missile. And there may be times, with Bill Cosby, he did a lot of amazing things. Not sure that he deserves another chance on what he has done, and he has essentially been canceled. However, there may be those moments, like I know that there's those moments for me where I make mistakes, and it's not a matter of if I'm going to make a mistake, but when I'm going to make a mistake. And my hope is that I don't get frozen in time for the thing that I said at this moment. It's really nice as a person that's deeply committed to inclusion to have individuals know that I can learn and grow, that they'll give me an opportunity to learn and grow. And I have had those opportunities so many times when somebody has, said, hey, did you know what you said feels like this to me? And that's an opportunity for me to address the wrong that I've done and let people know that this moment that I said this thing, hopefully this doesn't define me. This is a moment that I am learning, and I can hopefully continue that learning, right? So again, doesn't mean that you need to let anybody off the hook, but we're going to try to look in the moment to see if there are any opportunities there. What the model is not. It is not an algorithm or a roadmap. People often say, if I say this, then, what, and they say that, then what should I say? It's too complicated. Every interaction is different. People have their different intersectional identities. People have the different ways that they're behaving in a particular moment, including yourself. Again, in the morning, you might be more interested in upholding the principles of community. In the afternoon, you might just be like, forget it, I don't have energy for that. All of those things matter. The time, the place, the mood, the players, the power dynamics. So there's no way to have an algorithm. But what I'm hoping is to give you some tools for making decisions about how to handle a microaggression or incivilities or discrimination. It's not appropriate for every situation, especially overt racism or discrimination. And it's also not taking sides and trying to decide who's right or wrong. Remember that right or wrong is a binary, and that can create sort of a blindness on the part of different individuals. And I'll talk about that a little bit more in a minute. But we're just going to set aside for a moment the right or wrong. There could be a very clear, like, oh, that was egregious. But just for a moment, Let's think about how the interaction could be moved forward to reestablish and restore relationships. So simple, here is the microaggressions triangle model. We talked about this earlier, the recipient. Most people on this webinar have been the recipient of a microaggression at some point. I suspect that we could all get into conversations where we spend hours recounting and sharing the microaggressions that we've experienced, that we've accumulated over a lifetime. I know that I have lots, and it's easy to think about those. What's interesting then is to think about times when you have been the source of a microaggression. And it's interesting because the number of times doesn't come as quickly. You have to think harder about it and pull up those times. And there are a couple of reasons for that. One is that if the microaggression was the product of your unconscious bias, you may not even realize that you were the source of a microaggression. So it doesn't even occur to you that you could have been the source of. Those are the ones that scare me. What are my blind spots? What am I not seeing? What do I keep saying to people that they're having a feeling about what I've said that I have no idea about? So the other thing is that if you do become aware that you're the source of a microaggression, there's a couple things that your brain will try to do to protect your sense of self. You know, a violation to your sense of self, it is actually psychologically painful. So here's how we try to deal with it. One is that we will psychologically, I call it abscessing. You kind of abscess this experience and this memory so that you can forget about it. You can just set it aside, or it's hard to access that memory because it was so painful. So there's one thing. The other thing that we tend to do is we get into this self-motivated rationalization where we start to think about the many ways that we were right, or how somebody misunderstood us, or even to the point where you decide that you're actually the victim rather than the recipient, that you're the recipient rather than the recipient. And so that's hugely self-motivated. And if you've gone through that line of thinking, you're not going to think of yourself as the source. And then there's the bystander. So the bystander is an important individual. And with the bystander, there is often many missed opportunities to intervene when there's a microaggression or something really uncomfortable happening. And we sometimes like to think, well, I'm neutral, I'm not involved, I'm just going to take off. And here's the thing is that I know that feeling. I've had that feeling. I've probably acted upon that feeling, but there's no neutral. You know, the recipient probably wants to be neutral and not be involved in the situation, but they've been pulled into it. And likewise, as a bystander, you are there because you are in proximity and you witnessed it. And whatever you do is, it's going to have impact on somebody in this. So if you walk away, the recipient is going to feel the sense of lack of community, of lack of support, and that this behavior was condoned. And the source can be like, look, that person didn't say anything, so clearly I'm not in the wrong. It must have been okay because it was never challenged. So I want to bring you to the next slide. So I have two poll questions that build on each other. I want you to think of a time when you were the bystander to a microaggression, and I'll even expand that, when you were the bystander to a microaggression or an incivility. And I just want to know, yes or no, when you bring up that instance, did you intervene? So if you'd go ahead and pull up that poll, think of a time when you were the bystander to a microaggression, and did you intervene? Let's give it just a little bit longer so people can find the button and they can respond. All right, let's go ahead and see what we got for the poll. Oh, wow. 50-50. That is interesting. I wasn't quite sure how this polling was going to go. So 50-50. Sometimes people spoke up and sometimes they didn't speak up. Yeah, somebody said that they answered yes, but it's really sometimes. For me, it was situationally dependent. So absolutely, you know, there you can probably think of times when you did intervene or when you didn't intervene. And again, the situations are complicated. And it may not have been the right thing to address it right in the moment. Sometimes we can address it later. Um, let's go to the next poll question. So it's very similar, but this time, think of a time when you were a bystander and you did not intervene. So all that 50%. And then for those of you that did pick a time when you intervened, see if you can think of a time when you were a bystander and you did not intervene. What is the reason? What was the main reason that you did not intervene? I'm going to go ahead and open up that poll. This is when you were a bystander and you did not intervene. Why didn't you intervene? Just pick the one. I bet you have multiple answers there, but just pick the one that resonates with you the most. Just give it a minute or two. I'm looking at your comments in the chat. I'm loving the back and forth and the insights. Oh, that's awesome. There's somebody that says there was never a time that they can think of that they didn't intervene. That's wonderful, and kudos to you. I think that you might be in the minority, but I applaud you for that. It is particularly difficult in professional settings when the aggressor is a supervisor. Absolutely, the power dynamics cannot be underestimated at all. I mean, and that creates sort of a clear and present danger in terms of your work status. If it's your boss, you could get a poor evaluation, you could get fired. That is really hard to intervene in that moment. All right, what do we have? So for this group, the number one is I didn't know how to respond. How do I do this thing? That's terrifying to feel like you don't have the skills to intervene. The next one was fear of making the situation worse. I didn't know how to respond and fear of making the situation worse. I'm just gonna, if we go ahead and close the poll, I'm going to take you to another slide. So this is a data set that I have. Gotta move, hang on a sec, sorry about that. So in 2019, we surveyed 432 nurses. They were asked a very similar question about thinking about a time that they didn't intervene for an incivility. And this is basically what they said. The number one was fear of making the situation worse. And number two was I didn't know how to respond. There were some folks that were worried about getting in trouble. So again, if there's that power dynamic there, that can make it more complicated. Not enough time, would love to deal with that, but gotta go right now. If that is something that has come to your mind, sometimes the intervening doesn't have to happen this very second. And in fact, sometimes it's better for it not to happen right in the moment, especially if it's in a public area, in front of a patient, if it's in front of a big classroom full of people. It was better to stay out of it and be neutral was another response, okay? So interesting stuff. So let's start going through a scenario. I'm going to go through a scenario and then we'll sort of walk through the different ways that you can respond as a recipient, as a source, and as a bystander. So this is from my data. This is, we're going to call him Rick, an African-American male student who is telling me about an instance with his peers and interaction with his peers after exam. So this is what he says. Classmates were asking, okay, what did you get on the exam? And people responded, I got an A, a B, I got to retake it, things like that. I didn't even want to mention it, but I was specifically asked what I'd gotten. So I said, I got 100% on this exam. And people didn't believe it for some reason. Even though other people had a similar grade, everyone was kind of surprised that I got such a high score and didn't have to retake it. I can't help but wonder if it's because I'm Black. So interestingly, as I was creating the microaggressions toolkit and workshop, I ran these scenarios through different groups of people to see how they responded and were able to interpret these. This particular case scenario was interesting because folks were really divided on whether this was a microaggression or not. So there was a camp of people who was like, this is clearly a racialized microaggression, where they doubted Rick's intellectual ability to succeed on an exam like this. So clearly a microaggression. Don't even know why we were having a conversation about it. There was another group of people that said this was clearly not a microaggression. It's clear that the classmates were asking this because it's nearly impossible to get a perfect score on a nursing exam. So anybody that gets such a high score is going to be questioned on it. So I don't want to get into who's right or wrong. That's not what we're doing here. What we do want to do here is recognize that there can be different ways of viewing the situation. And it doesn't mean that one is right or wrong. In fact, there can be multiple truths, multiple perspectives that are happening at the same exact time. And if we are going to capture opportunities to promote inclusion, we need to be able to see that triangle and the multiple different points on it and what people are experiencing. So we'll start with the bystander response using the ARISE model. So the A in ARISE is about awareness. So this is in general, have it in your life as you're walking around in the world, understanding the ways in which different people, different groups, different backgrounds might be experiencing microaggressions. There may be an interaction that would not be a microaggression for you, but for the recipient, it is a microaggression. And I saw, I think it was Dr. Field saying something in the chat room about the previous trauma that people have had, that this moment can be triggering for them because of the many, many experiences that have preceded it, right? So you just need to be able to be in a space where you are aware that people might be responding different from you, and that people can be experiencing microaggressions in the ways that you don't understand yet. So this can be a learning experience. So here's what a bystander could say. When you expressed surprise about Rick's score, it seemed like you didn't believe him or didn't think he was capable of that score. Is that what you meant to convey? You can also respond with empathy and avoiding judgment. So avoiding judging the recipient. One of the things that happens way too often in our academic learning environments is that a student will experience a microaggression and they will maybe say something to an instructor or to a classmate, and people will say, you need to grow a thicker skin. And if we're going to use that metaphor, we need to recognize that you have no idea what the skin is like of the person that you're interacting with. Is the skin open wounds? Is the skin covered in scar tissue with weird numbness and tingling and odd feelings in it? What do you not know about this individual's skin in this particular instance? And again, if somebody is sensitive in this moment, doesn't mean that they're overly sensitive and over interact to every single thing, right? They're having a moment now, and that process of believing somebody and validating somebody can be really, really powerful, right? That if they're telling you that they had this experience, that experience is real for them. And they may have some insights into the dynamics that we as a faculty member or as a colleague or a coworker may not have. Also with the source, and this part is what can be really hard, especially if you're feeling triggered by the source or angry with the source, but taking just a moment to ask, Why would an otherwise good and decent person behave in this way in this moment? And this doesn't mean that you let anybody off the hook. It does not mean that you let anybody off the hook, but it just asks you to pause for a moment to think about why they would behave this way. It may be that they are fearful of being called out, or of, I think faculty member in classroom settings, we're often terrified that a student is going to recognize that we don't know something and we're going to be humiliated in front of a classroom full of people. It may be that the source has really no idea what the context is. It may be the source is being a jerk and is intentionally being a jerk. And you can come to all of those conclusions with your assessment skills, but you will only do that well if you pause for a moment and ask yourself that question. Then the inquiry, the I in Arise, is approach the situation with curiosity and make inquiries. For example, just saying simply, what did you mean by that statement? And so that can be an opportunity for them to clarify, but it also gives them the opportunity to reflect. If they're asking me what I meant by that, how might they have interpreted what I meant? So that's really what you're hoping for, is that you'll get them to notice you said something. Why don't you think about that for a moment? Statements that start with I. A bystander can also use I statements to talk about how the comment made them feel. It might be, for example, I noticed, I felt, I've been thinking about. And so in this situation with Rick, you might say to the source, I noticed that when you question Rick's score, he became very quiet. How do you think that was for him? Right? Or I noticed this, and I've been thinking about, or I've been wondering about perhaps what was meant by that statement. You can also use educate and engage. And this one can be something to the effect of, I know you didn't intend to harm anyone, but I wanted to let you know that when you were questioning Rick's score, or when that conversation was happening about the scoring, that it seemed like this thing was happening. And I don't know if you intended that or not, but I wanted to let you know as your friend, right? I've had people do this for me many times, and I really appreciate it. As an associate dean for health equity, diversity, inclusion, sometimes I feel like people expect me to act perfectly or to say things perfectly. And again, I'm going to say it's not if, it's when I am going to mess it up. People have come and said, Piri, I know that you are committed to issues around DEI. And because of that, I wanted to let you know that when you said fill in the blank, it sounded like fill in the blank, right? And I, honestly am deeply grateful for people that have done that for me. All right, when you're the source, when you begin to realize that maybe something that you said is not going over the way that you expect, here is the assist model. So the first thing is acknowledging that you, like everybody else, has bias, both conscious bias and unconscious bias. And it can be difficult because oftentimes our unconscious bias does not align with the values that we have, or what it is that we want to portray to the outer world. So getting right with that and doing the daily work of looking at that bias and unpacking that bias. And so the S is about seeking feedback. So you might say, for example, I noticed that when we were talking about the quiz scores, you became quiet. How was that interaction for you, right? Or it may be that you have said a joke. I noticed that when I made that joke about, such and such, you weren't laughing. And now I'm wondering how that interaction was for you. So seeking that feedback. Saying that you're sorry. Apologies can be difficult, especially because we often think that if we apologize, it's admitting wrongdoing, or it's admitting that we intended to do this thing. An apology should be more about recognizing somebody else's experience, recognizing their pain. And whether you intended it or not, this is a good time to learn and learn about somebody else and to acknowledge them, right? We should focus on the impact, not the intent. So whether your intention was to hurt another person or not, this is a great opportunity to learn. So a way that you could do that is to say, Although it wasn't my intention to harm you, I see now how my questioning your score affected you, and I'm sorry. So you can say the intention if that's true. You name what it is so that it's very clear that you understand what the microaggression was, and you give the authentic sorry. Saying, I'm sorry you were offended, that's not an apology. You're actually blaming the recipient, and you're further escalating that experience for the person. So hopefully, the person will interact with you and stay in relationship with you. If they've had the courage to give you feedback and let you know, like if you didn't figure it out on your own and they said, hey, just wanted you to know that ouch, that was an ouchie. Thank them for their feedback. This is a gift. If somebody gives you a gift, you say thank you to them. I appreciate you taking the time to help me grow as a person. And remember, it's scary for other people to approach you. It's not knowing what to say. It's fear of making the situation worse. So if somebody has taken the time to give you feedback, they have had faith in your ability to learn and grow. That's a compliment to you that they would share that with you. So thank you for that. All right, let's go, skip the slide. So when you're the recipient, this is, one of the hardest positions to be in. And sometimes it's not always that easy for the recipient to say something, especially when we talk about those hierarchies. If you're the student and it's a faculty member, if you're an employee and it's your supervisor. That said, I, as a faculty member, have had students come to me and, let me know about a microaggression. I think part of it as a faculty member is being approachable so that students feel like you would be willing to hear that, being vulnerable. If you have been the source of going back and owning that and having it be a learning opportunity. In fact, I was doing a workshop like this for hundreds of people when I said something that was, I think fell into the category of microaggression, and somebody private chatted me about it. So appreciative that they private chatted me rather than blasting it out to everybody, told me clearly what it was I had done. And then I had the opportunity to go back and say, hey, I wanna clearly talk about this thing that I said earlier. That was a microaggression. This is why, and I'm really sorry about it, right? So creating that space where people feel comfortable for you to come do that. So we're talking about the recipient. So what would you do as a recipient if it felt like this was a safe time for you to do it? You might ask a clarifying question of your classmate. You seem surprised that I got a high score. Does that surprise you? If you come from curiosity, not judgment, you might say, I want to better understand your surprise. Can you explain it to me? You may tell what you observed in a factual manner. I noticed that when you questioned other students about their score, you didn't express the same surprises when you talked to me about my score, right? Impact exploration, this is your moment to say, ouch, your comment made me feel like, versus owning your own thoughts and feelings, which is going a little bit deeper into it, where you might say, ouch, this made me feel uncomfortable or devalued, and let them know it's difficult being the only underrepresented student in our cohort. People often think I'm here only to fulfill a diversity goal. And that's hard because I've always done well in school. And as the recipient, you are assessing the response of the source to determine what next steps are. Next steps could be if they're like, oh my gosh, I didn't think of it that way. I'm so sorry, this is what I intended, or whatever. That's something that you can work with, versus somebody that's like, oh my God, you're being totally oversensitive. Why are you responding like that? Are you calling me racist? That might be, I need to get myself away from this individual for my own safety and well-being in this moment, right? And any of those decisions are legit decisions. I want to go now into a case scenario, but one thing I want to say before we go into it is that when you bring in any of these triangle model approaches, that it's important to be authentically you. I mean, some people in their bystander approach or even in their recipient approach will use humor. And if humor is something that you're comfortable with, that's part of your personality. Yes, humor can be an important tool. It's one of many tools to choose from. If humor is not your go-to, this is probably not time for your comedic debut. You might want to use something that's a little more sincere and aligned with your personality, but you want to be authentic in whatever it is that you're saying or whatever you've chosen to do. All right. So I'm gonna read this scenario to you, and then we're gonna go into the chat room. I'm interested in what your responses to this is gonna be. This is, again, from my data. These are two young men. They're actually medical students who I interviewed them separately. Neither of them knew that the other one was interviewing, and they recounted the same story. So one of them, they're talking with a white male professor. It's an interaction that they're having. One of them, Davion, says, so me and a fellow classmate who is also Black, were coming in early to get some last minute studying in before finals. And we ran into a professor that we had in block 1. And I held the door open for him and said, hi, how's it going? And then he's like, oh, hi, how you boys doing? They haven't kicked you out yet? I don't know. Was it unintentional or did it have deeper meaning? And me and my friend looked at each other and we were in shock a little bit and didn't know how to address it. But we just went on and studied. But it was interesting because microaggressions don't usually get to me. But like, I think with this one, I was like, man, like for 10 minutes instead of studying, I was like, ugh, did he really just say that? So Rashid had a similar accounting. He said, there was a time when I saw a previous professor who I consider a friend, and I think he considers me a friend as well. And me and a classmate, he's also African-American, were walking in the building. And he was like, oh, they haven't kicked you out yet? We're friends, like sarcasm, whatever. But to somebody who isn't like me, they could have easily been hurt by that, struck by that, triggered by that. And I was a bit too. I was kind of like, what? So I want you to think about that a little bit. And we're going to use the chat feature at the moment. I'm going to bring the chat up on my screen so I can see you. And I'm interested to know what microaggression or microaggressions did you notice? And I'm not going to be able to respond to everybody, but I want to get just a sense of what people noticed in terms of a microaggression that happened. Mm-hmm. Good. So yes, okay, you got it. So there are a couple of things happening here. You boys, absolutely, you boys is a problem. Kicking them out, assuming, calling adult men boys, assuming they are kicked out because of race or that they would have bad behavior. Yeah, you boys is a huge problem. Inferring that they would be kicked out, possibly due to race. Awesome. Yes, these are exactly the things that I was hoping that you would say. I just need 1 second here. I want to see, I just need to, just give me 1 moment. Okay. So I just want to go into each of these things. So boys is problematic. So we can look at boys as a microaggression in a couple of different ways. It is ageist, for one. None of our students in medical school or nursing school are children. So we shouldn't be referring to students as kids, and we shouldn't be calling them boys and girls. They are adults, many of whom have had experiences that we have not had, where they have more insight into racism, discrimination, poverty than we have in our pinky finger, right? And so it's inappropriate to be referring to adults as boys or children. So there's part 1. Part 2 is the history of the term boy in the United States as weaponized against Black men in our history. In slave times, when people were enslaved, their enslavers insisted that the enslavers were called masters, whereas the enslaved were referred to as boys. So this was a daily reminder of the positionality that happened, where people were valued and where the power lie and what options and resources were available. This has been pervasive over time. We have seen in the Jim Crow South that, the term boy, police officer to black man. This is, a story that my dad, black man, talks about, police officer coming up with his hands tucked in his pockets and saying, hey boy, what you doing around here? Kind of thing. And that term boy to an adult man is inappropriate. And it is definitely weaponized, right? Nelson Mandela talks about being referred to as a boy when he was on Robben Island and how that was intentional to let him know his place. So the other thing is about being kicked out. Being kicked out seemed, some people mentioned that it could be threatening, and also the assumption that they would be behaving poorly while they're in school and therefore would deserve being kicked out, or that they weren't academically capable and were being kicked out. These students have no idea if he was just in a progressions meeting and they talked about how they were going to kick out Davion and Rashid, and they're surprised, and he's surprised that they're still here because they're going to be kicked out any day. So those are microaggressions. And so I want to ask this question. What do you think the impact was? Or did they even say what was the impact of this microaggression? Or what could have been the impact of that microaggression? What do you think the impact is? Exacerbates imposter syndrome. Absolutely, that sense of belonging, not seeing other students that look like you or faculty that looks like you makes you feel like you don't belong and maybe that you are going to fail. It makes students feel inferior. Let's see, it feels like a macroaggression. It can exacerbate stereotype threat. And think about, I think it was Davion who said, they were trying to study and they were distracted from studying. They're going into finals. So they're studying before finals and they're distracted from studying because they're trying to figure out what this interaction was, what just happened with the professor. So there are impacts, there are clear impacts. It could impact the relationship and the friendship. It is very likely that Rashid is going to mistrust the professor at this point. Anxiety, absolutely, all of those things, excellent. So think about this. Now we're going to put ourselves in the shoes of the source, the white professor. What was he up to? Why, just ask yourself that question. Why would an otherwise good and decent person behave the way that he behaved? What's going on with the professor? Suddenly I have 53 new. He was trying to be chummy. Yeah. Lack of insights on his comments, trying to be cool. All of those things are very, very likely. I mean, we don't know. We weren't there. But Rashid said that this is like a friend, whatever. So he's trying to be chummy. He probably thinks that he's being funny. And maybe this is his shtick. Maybe he says this to every student. They haven't kicked you out yet. But not realizing that particular comment, which went over fine with other students, and they're like, oh yeah, whatever, professor, that this would have a particular impact on the only two Black men in that cohort. And that, Davion said a little bit later, like that he felt was another level of microaggression, that the professor just had no insight into what the experiences of Black students would be, and that ignorance is not okay. And that we as faculty members, we in academia, we as educated people in health professions, we need to educate ourselves about groups of people that are different from us. Because yeah, for some people have said, oh, I use the word boy or girl. Somebody talked about being called gal, that we will use those terms and they don't really have any meaning for us in our minds. And that's fine and okay, but we need to understand that there are circumstances when those kinds of words can mean something different to different groups. So by knowing African-American history, you get some insight into what it would be like to be called boy, what it is like to be thought of as being, going to be kicked out at any moment, right? I am from California. I use the word dude all the time. I call my kids dude. They call me dude. It's kind of a nonsense word, but I did have a student come up to me after class and said, Piri, I know that you're dedicated to diversity, equity, inclusion. And so I just wanted you to know that the word dude is very gendered and you use gendered language a lot. And sometimes that can have an impact on some of us in the classroom. Whoa, didn't think about that. What a gift that somebody could let me know about a blind spot. So yeah, he might have thought he was being chummy and really just had no insight into the impact that had for Davion and Rashid. Doesn't mean that that's okay. Doesn't mean that he gets away with it, right? We probably need to address the situation. So what are some potential interventions of a bystander? Imagine that you're there in the library. When they open the door, you heard this interaction. Let's say that you are a colleague with a professor. You're lateral to him. He's not your best friend, but you've been working together for a while. You talk about your kids, that kind of stuff. So that's your situation, lateral. What are some things that you could do or say as the bystander using the ARISE model? Here's somebody from a male perspective, my husband listening with me. That professor knew what he was saying. No man likes to be called boy. That is absolutely a possibility in this. Okay, so here's some things coming in. Saying to the source, what did you mean to that state? What did you mean by the statement you just made to the two medical students? So that's just simply inquiry. What happened there? Okay, what did you mean by that? It is good. Yeah, dude, not good. Yeah, I know, huh? Working on it. So so Amy says, ask what was meant by the term boys. So it could just be simply, you use the term boy. What did you mean by the term boy? Think about how that can be an insult. So I know where you're going with this, and I'm wondering how we could phrase it in a way that the source can hear it. It's this hard thing that we don't want to hamper the source, but we do want them to hopefully engage and improve their behavior. So you might say something to the effect of, I noticed that when you made that comment that Davion and Rashid, their faces dropped and they became quiet. I wonder how they experienced that interaction. What do you think? Right? That might be a way to get the source to think about how insulting that could have been. He was trying to connect with them in a humorous way, but had no idea how it would be received because he doesn't see color. So that actually is, I feel like that's something that we can work with, right? If somebody is intending to connect with other people, that is something to work with. If he was clearly, and you have no doubt in your mind, trying to be a jerk, that's a different approach. But if you think that he was trying to be humorous and connect with, we can build on that value of connecting. You might say something like, I know that you joke around with students and that you like to connect with students. However, when you said that, it made me wonder and it made me feel, right? And so you can help him reflect on, or you might just simply start educating and say, hey, as a person of color, I use this often. When things like that have been said to me, this is how it felt, right? Good. Watch for an opportunity to respond with empathy and understanding. And that's for the recipients. Like, is anybody going to go say, hey, Davion, Rashid, how are you doing? I noticed this thing happened. How was that interaction for you, right? Hey, John, are you aware how that came across? Awesome. So again, these are all great things. Think about trying to make sure that you are authentic in your approaches, looking for a way to have this be a teachable moment for the individual and making sure that we don't forget the recipients. What do they need? They probably just need to be validated and believed, but an intervention might be necessary as well. So I am going to stop here so that there's an opportunity for us to take some questions. I'm just really grateful that you are all interested in this topic and that you spent this hour and 25 minutes with me.
So thank you everyone for attending today's session. Piri, this was such great work. I love that your triangle model humanizes individuals. Our profession, our society will benefit when humanism is more widely adopted in our day-to-day interactions. You have so many questions. I'm going to start with this one. From a philosophical standpoint, when we are trying to distinguish between impact versus intentionality, are we also then communicating and internalizing the idea that the ends versus justify the means?
Yeah, thank you for asking that question in such a clear way, because it's really easy for us to go down that road, right? That it's all about intention. And, intention, I think in terms of the triangle matters, because if somebody's intention is to connect with and they value diversity, equity, inclusion, there's something to work with. If you are recognizing that their intention is to create fear and pain and create a divide, that means that the decisions you'll be making are different. And so in that way, intention does matter. On the other hand, though, when somebody is injured, like when somebody steps on your foot, having somebody say, "Oh, I didn't mean to do that, sorry," doesn't make that pain go away, right? There's more accountability that needs to happen on that end. So absolutely not. The intention doesn't justify what came out of somebody's mouth. And we really need people to be accountable for that. Authentic apologies and hearing of the individual who is the recipient of that. Thank you for making that point really clear.
I like that. So another question, what role does an Office for the Prevention of Harassment and Discrimination, or HR, have in the absence of an EDI office in the prevention and management of microaggressions when there's no overt reference to race or any other protected class?
Yeah, so that is my life, is trying to figure out how do we navigate that. And so this is so complex because offices that address harassment and discrimination, usually those are based on some clear identity and some clear thing. And what is so difficult about microaggressions is that they're subtle. And somebody can say, "Oh, I didn't mean it that way," or "Oh, I was just kidding," and nothing happens around that. But generally speaking, microaggressions by an individual repeated over time, that they're escalating up to something that is going to be reportable. It's nice to have a mechanism to get in front of those sorts of things, to be proactive. So if you have a reporting mechanism, hopefully somebody's looking at that data and looking for who are their names that are coming up over and over and over. If so-and-so's name keeps coming up and it's not something that we can actually report as discrimination, we might need to go to them and say, "Hey, we've been noticing this thing." And that's when you have inclusion enhancement plans where you say, "We've noticed this over and over. We'd like you to take this class, do this, and we want to see, improvement in this measurable way by this measurable time."
Okay, that sounds great. We have time for one last question. They said you focus on resilience of the learner, and that puts the responsibility on them to rise above when the focus needs to be on the workplace or the school to change.
Yes.
Are those who are told they aren't resilient being blamed for the school workplace failure? What does that feel like, and how does it impact their psyche to have failed?
Right. So that is exactly what some of the issues can be around a focus on resilience, that you need to take away the harmful mechanism. Quit asking students of color and people from underrepresented, underserved backgrounds to be resilient. You get to the point where you're like so resilient that you're just like in a ball, right? Mm-hmm. So yes, resilience is good, but the institution needs to stop asking students or making students be resilient by changing the organizational policies and procedures and the way that they deal with microaggressions, discrimination, and the climate. So your point is like a mic drop. Like, yes, that is the exact point of that.
So we have to marry resilience with change.
Right.
Thank you. Thank you, Dr. Ackerman-Barger, and thank you everyone for attending today's session. You will receive the slides and the recording. Have a great day.
Thank you. Bye-bye.